Hi, my name is Magdalena Pasarica. I'm a family medicine doctor. Also have a PhD in nutrition. I attended medical school at University of Medicine and Pharmacy in Bucharest. It's called Carol Davila. And then my residency was in Arkansas. It was a small town. It was an unopposed residency, a really fun experience. And the reason I've done family medicine is because I saw a lot of potential in building relationships with patients. This is very rewarding to me. And I decided to choose family medicine to learn everything about everyone and be able to provide care. As a family medicine physician, I was fortunate enough to achieve a lot of leadership position in academia. So in residency, I was assistant program director for the family medicine residency at Florida Hospital. And at the medical school, I was course director. I was clerkship director for the internal family medicine clerkship. I was assistant dean for clinical medical education for M3 and 4 at UCF. And I've been the medical director for the Knights Clinic for the past 12 years. So in professional service, meaning at our professional organization, Society of Teachers of Family Medicine, I've had several roles of leadership there also as chair of several committees, especially on education. So you can see as a family medicine doc, you can have a lot of leadership positions, and depending on your interest, you can focus on any of them. I practice at the Free Clinic, at the Knights Clinic, and at the Grace Medical Home. This allows me to see patients without insurance under the poverty level, and it is to me very rewarding. The reason I chose this practice is because I want to make sure all I do is for the patients who really don't have access to care, and I treat them as good as you would treat someone with insurance. And it's just even more rewarding the fact that I get to practice this with you all, with the students, the medical students, the counseling students, social worker from these students, and we can truly have the opportunity to provide a complete medical care to the patients who need it the most. This is outpatient only, but in the past, I've done outpatient and inpatient. My preference is for outpatient, and that's why I pursue this role. But depending on your preference, you can do either or a combination of those. So, as a family medicine doc working at a free clinic, outpatient clinic, my typical day looks like I have about half an hour per patient, and I'm fortunate to have that. Usually, private clinics have about 15 minutes per patient, which is a lot, especially for the complicated patients that we see in family medicine. And I can address things from um, joint problems to diabetes to gout to rheumatoid arthritis to postpartum care to post-surgery care to heart disease. You know, as family medicine docs, we go through each of these. So every day looks different and every day is exciting because a patient can come with 3 or 4 problems from different systems. And that's what's rewarding about family medicine and challenging at the same time. I happen to be very much in favor of procedures. Procedures come really easy to me and they bring me a lot of joy. So in my practice, I do a lot of procedures, either joint injections or skin lesion removal or biopsies. We do IUD insertion, we call colposcopies. Anything that can be done in the office, we try and do it, and it gives me a lot of A lot of pleasure. Now, one of the questions that usually students ask me is, as a family medicine doc, as a primary care doc, do you refer a lot? And the answer is I refer sometimes, but not all the time. You do, for example, let's take a patient with diabetes. So you take a patient with diabetes, you diagnose them, you treat them as you can with all the resources that you have. You start them on lifestyle changes, you start them on medicine, one, two, three medicine. And then at one point, they need, let's say, an insulin pump. Unfortunately, in primary care, there's not as much focus on devices and technology. So you need to send them to a endocrinology clinic so that they have the support they needed to prescribe a pump and help the patient with the pump. But all the way through that, we can certainly do that. You have a patient with hypertension, hyperlipidemia, you treat them. At one point, they're going to need cardiac cath or they're going to need a stress test. In our clinic, we're not able to do that, so we send them to cardiology. So you can see we treat a lot, as much as we can, and then if needed, we refer them later on. I do provide service to underserved community. My practice is based on service for underserved community, and it's only serving those who need the most and who don't have insurance. And this is very rewarding to me. And you'll hear this from everybody, I think, who provides free care to patients. Why is this rewarding? It's because you get to provide care for those in need, and you get to help them and treat them just as you treat patients with high income and lots of insurances and lots of coverages. So, and these patients truly, truly need your help, and they may have not received medical care for years. They may have not received careful medical care for years and high quality. So it's really rewarding to see how you can influence the life of a person this way. And one of the questions was, what skills do you need? I think the listening skills are the skills that you need the most as a physician in general, but especially for underserved communities. Listening is very important. And sometimes you may have patients who cannot afford a $4 a month medicine. So you have to be able to listen and figure out what can you do for this patient so they can afford the treatment that you prescribe them. Sometimes patients want to eat healthy and they want to be active, but they can't, right? They may not have money for a gym membership, or they may not have money to buy healthy food. So you have to really work with them and see what is within the reach that you can make it happen for them so that it also aligns with their health goals. Sometimes, and I remember a patient with asthma who would come with asthma exacerbation, and he was allergic to grass and pollen, but his job was he was cutting grass. So you can imagine he had exacerbations all the time. And I kept talking to him, and um, he just said, yes, yes, I'll avoid this, but never happened. So um, it is very important to know, to talk to person, listen to them and hear their story and see what they can do. And once we learned that was his job and he couldn't change it because this was his income, we try to provide different resources for him to create a barrier between the allergen and him. So I think listening and I think thinking outside the box for this patient is very important. So primary care is special, right? Primary care involves a lot of relationships with people. So what you need to be aware when looking in family medicine is that these relationships are very rewarding, and you create relationship with people by their families too, and their kids and grandkids and everybody. So that's very rewarding. But depending on your personality, it could be very taxing also, right? So you have to worry about these people day in and day out. You have to follow up in primary care. That's what you do. So if you're one that thrives on this, knowing that what you did was, impactful for the patient is doing well, then this is the right job for you. If this is taxing for you, worrying about people, following up, then it may not be the best match. So depending on what you like, you may or may not be the match. What gives you the opportunity, though, and I think this is very important for you to know, is you can have different lives in family medicine because you can choose to do procedures. You can choose to not do procedures. You can choose to do inpatient and outpatient both, or just inpatient or just outpatient. You can choose to do urgent care or be a hospitalist. So you have a lot of choices. So as far as lifestyle, you can choose the lifestyle that you want, and based on the opportunities in your career. And there are a lot of opportunities to adapt to what you want, in particular at this stage in your life. So flexibility is something in family medicine that is really a benefit for all of you thinking about family medicine. So primary care is special, right? Primary care involves a lot of relationships with people. So what you need to be aware when looking in family medicine is that these relationships are very rewarding, and you create relationship with people by their families too, and their kids and grandkids and everybody. So that's very rewarding. But depending on your personality, it could be very taxing also, right? So you have to worry about these people day in and day out. You have to follow up in primary care. That's what you do. So if you're one that thrives on this, knowing that what you did was, impactful for the patient is doing well, then this is the right job for you. If this is taxing for you, worrying about people, following up, then it may not be the best match. So depending on what you like, you may or may not be the match. What gives you the opportunity, though, and I think this is very important for you to know, is you can have different lives in family medicine because you can choose to do procedures. You can choose to not do procedures. You can choose to do inpatient and outpatient both, or just inpatient or just outpatient. You can choose to do urgent care or be a hospitalist. So you have a lot of choices. So as far as lifestyle, you can choose the lifestyle that you want, and based on the opportunities in your career. And there are a lot of opportunities to adapt to what you want, in particular at this stage in your life. So flexibility is something in family medicine that is really a benefit for all of you thinking about family medicine. So the future of primary care, I believe it's going to be more and more important. I know some people are afraid that primary care docs are going to be replaced by providers, but I think doctors in primary care, especially in family medicine, cannot be replaced. I think in the future, primary care will be much more important than it was so far. I think it's going to be more recognized and hopefully more reimbursed, for the question before about the reimbursement. Um, as medicine progresses and you see a lot of integration with technology, with AI, we know that family medicine and primary care docs are very adaptable and flexible, and this is requirement for the future of medicine. So I think we're going to see a lot more primary care and family medicine in the future, and highly reimbursed, because truly we're going to need doctors who don't treat just one part of the body, but they treat the patient as a whole. And that's the job of the family medicine doc. So if you ask me about the future of primary care, I think it's really going to be more and more important. Okay, so this is question number 9. For the students interested in primary care, I couldn't be more excited for you. I think that's a great opportunity to explore a specialty, a very rewarding specialty. I encourage you to truly explore it before you make a decision, because you have to be sure that you are a good fit. Um, I think talk to people in family medicine, see if they fit your personality. Everybody needs to fit their so-called tribe, right? To see where your tribe is. See if you like the lifestyle of people in family medicine. See if you like how they approach patient care. See if you like and you resonate with their values and their goals. And if you do, then this is it for you. Now, you do have to be aware that family medicine is tough. You're going to have to treat all the patients of all ages and all systems. As I mentioned before, you can specialize in certain parts, but you would learn all of this. So it's challenging. So you really have to be on it and study and be very good at what you do. But the rewards are just tremendous. So see if you fit, and if you do, then I'm very happy for you and happy to support you in any way I can.